So it's been 3 months since I've had my son and my hair is starting to thin as expected. So today I want to share with you guys what I've started doing to combat postpartum hair loss and discuss treatments that can be done for postpartum hair thinning, especially if you are breastfeeding. And I also want to update you guys on some of the new hair care products I've been using this period to address my hair concerns. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. If you enjoy learning about skin and hair care content, please give this video a thumbs up and consider subscribing to my channel. Now, before we jump into postpartum hair loss, this video does include a sponsorship with iRestore. And I'll tell you guys in a bit why I have restarted using this device the past month and really have been using it on and off the past 4 years to help improve the density and overall quality and health of my hair. Okay, now let's talk about postpartum hair thinning. I feel like there's nothing more dreadful than knowing that your hair is going to thin and then waiting for it to happen. All the while knowing that there's nothing that you can really do to prevent it from happening. I mean, that right there is really postpartum hair loss. And so many women, including myself, experience this. About 50% of women will experience hair thinning to a degree after having a baby. So why does it happen? So why postpartum hair loss occurs and really why it's not preventable has to do with the hormone changes that occurs naturally around pregnancy and then postpartum. So when you look at our hair under normal circumstances, it's very natural and normal for us to lose, anywhere from 100 to even 150 strands of hair per day. And that is because when you look at the scalp at any point in time, we all have roughly about 85 to 90% of hair in the growing or anagen phase. And then about maybe 10% in what's called the telogen or resting phase. And then the rest is in the transition or shedding phase. And that is normal hair cycle that our hair follicle goes through to shed hair and grow new hair. Now, what is happening postpartum, and the condition medically is also called telogen fluvium, is that with hormone changes, it's just naturally during pregnancy shifting more hair from the resting and shedding phase to the growing phase. So more hair is shifted into the anagen phase, and that is why a lot of people comment that pregnancy skin and hair glow. And then after having the baby, the hormone levels drop, and that triggers your scalp to basically change the hair that was shifted from growing back to its natural state. So from anagen to telogen phase. And because telogen phase is naturally about 3 to 4 months, this is why most moms will notice hair thinning starting 3 to 4 months roughly postpartum. And postpartum hair loss, even though it's more of a gradual process, it does feel like it just hits you like a train and you just also notice it one day. Moms will notice clumps of hair coming out when they're showering or clogging the shower drain, hair everywhere on the bathroom floor, or the density of their ponytail is not as thick as before. And all of those ways are common presentations of postpartum hair thinning. Now, I mentioned earlier, postpartum hair loss is really categorized under the medical condition called telogen fluvium, which is a type of non-scarring hair loss that is not unique to postpartum. In fact, many other medical conditions and other things can trigger telogen effluvium. Common things that can cause telogen effluvium, aside from having a baby, includes recent illnesses, recent surgery, like if you have had COVID, the flu, if you are grieving, studying for medical school, if you went on a crash diet and lost a lot of weight. Basically, any sort of stressors on your body, medically, surgically, mentally, can contribute to telogen effluvium. But the good news is telogen effluvium is usually a temporary phase, and often that hair thinning, hair shedding will reverse over time. So most moms will notice a decrease in the shedding about 6 to 9 months postpartum, and then 9 to 12 or even 15 months later after having the baby, they will start to see hair growing back. Now that's a long time. And then also for some women, they don't fully recover, meaning their hair volume and density just isn't as full or as thick before they've gone through the postpartum hair loss. And I'll get into why that may be in a little bit. Postpartum hair loss can be so frustrating, and I feel like it's just another stressor that is added to everything else that we are experiencing after having a baby. So even though it's not preventable, I want to let you know that there are options available out there that are safe and effective, especially if you are breastfeeding. So let's talk about them. Now, the first treatment option is called low-level laser or light therapy, LLL LT. Essentially what it is using low levels of laser and light energy to stimulate your hair follicles. Here, that low level of laser and light energy act like nutrients and water to the cells in your hair follicles, and it's readily taken up by those cells and stimulate those cells towards the growing phase. So you have less hair in the shedding phase, more hair growing, improving the overall health and density of your hair. This concept has been well studied and has been shown to work, especially in the context of treating androgenetic hair loss, so female and male pattern hair loss, but can be very helpful for other types of non-scarring hair loss, namely telogen effluvium. This treatment is safe, especially if you're breastfeeding. Now, there are a lot of laser hair devices on the market, but I want to share with you guys why I personally use and recommend the iRestore Pro device. Number one, it's FDA cleared and clinically proven. The Pro device contains 282 laser and LED lights that's unique to this system, and it offers more breadth and depth of coverage to maximize potential hair growth. But what I love most is how convenient it is. As a busy mom of two, any treatment that allows me to also multitask at the same time is a plus. And all you need to do for the treatment is wear this 25 minutes every other day. So I'll just pop this on when my son's napping, when I'm finishing up some emails, or wear this at the end of the day in bed when I'm watching TV. This does come with a cord that you have to plug into the wall, but you can certainly buy a battery pack on iRestore if you want to walk around and be mobile. Another thing that's great about low-level laser therapy is that it works really well with other hair loss treatments. It doesn't interfere. In fact, the combination often will yield better results. Now, obviously, everybody will respond differently, but you should start to notice an improvement usually 3 to 6 months once you start the treatment. Now, certainly, this device is an investment, which is why you don't want to miss out on iRestore's New Year sale happening right now, where you get to save hundreds of dollars and get a free gift card of purchase. One last thing I really appreciate with iRestore is that they offer a 12-month money-back guarantee to allow you adequate time to use this device to see if it works for you. The next treatment that can be helpful is topical minoxidil. Go with 5% over the tube, and I personally like the foam over the solution. Now, when it comes to treating hair thinning, hair loss with what's available over the counter, there's nothing that can beat topical minoxidil. And what question I always get from my female followers on social media is, can I use the 5% minoxidil or 5% Rogaine? And that question stems from the fact that on the men's version, there is do not use warning for women. And that has to do with the fact that Rogaine was initially approved only for men, but now we had women's version of Rogaine that's 5%, just more expensive. But certainly women can use Rogaine, women can use men's version, and vice versa. So it's 100% safe for men and women. Now, even though it is FDA approved and has been mostly studied for treatment of androgenic hair loss, as a dermatologist, I recommend this to majority of patients that come to see me for hair thinning. Unless they have no hair follicles left, I most certainly will recommend to them at least giving topical minoxidil a try. Because of all the things that I prescribe and recommend, topical minoxidil does work for the most part and has the least amount of side effects. Now, it is something that you do have to use consistently for about 3 to 6 months before you would notice improvement. And there is this scary initial phase of hair shedding. To me, that actually is a sign that you're responding to it, because what it's doing is minoxidil is shifting your hair follicles to the growing phase. And for that to happen, hair needs to be shed to go into that anagen phase. So once you get past that, you will start to notice improvement. Another question I get asked about is, do I have to use topical minoxidil forever? So it really depends on the hair loss that you're treating. For conditions like female male pattern hair loss, which we know is a chronic and progressive condition, yes, you do. But for treating postpartum hair loss or telogen effluvium, where we know for the most part is more of a temporary shock to your hair follicles, you do not need to use it forever. You use it until you feel like your hair density is where you like it to be, and then you can stop. Now, certainly your hair may not feel as full as maybe you were on the minoxidil, but certainly you're not going to lose all the hair that you've grown while on it, like you would if you had androgenetic alopecia. If you are breastfeeding, there is limited information on the safety of topical minoxidil during lactation. However, what I can tell you is that very small amounts of it gets absorbed through the skin, and according to the American Academy of Pediatrics, they state that topical minoxidil can be compared compatible with breastfeeding. So if you are going to start this, my recommendation is just talk to your pediatrician, talk to your provider first before you start. So the next treatment option is called PRP, or platelet-rich plasma. This is a procedure done by cosmetic dermatologists for photo rejuvenation, treating fine lines and wrinkles, but also used by other physicians, like namely orthopedic surgeons, for joint rejuvenation, and has gained quite a bit of popularity over the past years for treating hair loss. Again, mostly for treating androgenic hair loss, but certainly can be helpful for postpartum hair thinning. Essentially what it is drawing out one's own blood and then spinning it down to separate the plasma component that is rich in platelets from the rest of the blood. And that portion of that plasma rich in platelets is yellow or golden in color, which is why often PRP is referred to liquid gold. But it's abundant in growth factors and nutrients that can promote cellular growth. And then that liquid gold is then drawn into syringes and then injected back into the same individual where it's needed. So on the face for skin rejuvenation, and then on the scalp to promote hair growth. Now, when this is done right by a trained and experienced provider, it is safe even if you are breastfeeding. I think the only downside, just aside from the procedure itself, that may not be everybody's cup of tea, but the main downside to PRP is the fact that it's not covered by insurance and can get expensive. An average treatment session is about 3 to 5 sessions. They're usually done every 4 to 6 weeks apart. And some people may need additional maintenance sessions after that treatment session. So if this is something you're interested in, I would just say find a dermatologist or provider that is experienced in doing this and talk to them about your hair loss concerns and see if you would be a good candidate. So the last treatment option that can be helpful for postpartum hair thinning is oral spironolactone. And you may be wondering, why is this medication talked about here? Now, as a dermatologist, and you guys probably know this already, I prescribe this medicine most commonly to treat hormonal acne, hirsutism, and hair loss in women due to androgen-driven process. So from polycystic ovarian syndrome, or women who have that genetic androgenic hair loss. Reason why I am talking about it here in this context is that if you guys remember earlier, I mentioned for some women, they never fully recover that hair loss. They continue to have hair loss, or their hair is just much thinner compared to pre-pregnancy. And that could be due to a fact that telogen effluvium can unmask that genetic hair loss. What I mean by that is that in individuals who have that genetic predisposition to getting androgenic hair loss, having that shock to your body postpartum just kind of bubbled that condition to the surface a little faster than it would occur otherwise. So we actually know this phenomenon very well in dermatology, the sense that telogen effluvium can bring out or unmask androgenic alopecia in someone who is genetically predisposed. The treatment for spironolactone here is really to target the androgenic hair loss. So it's really ideal for women who continues to experience hair shedding even 9, 12 months postpartum, where really that hair shedding process, if it's just due to postpartum, should have halted. And here, obviously, you would want to speak to your dermatologist to have the proper diagnosis. And if you are breastfeeding, it is something that is safe to do. It can affect your milk supply. So if you are early in your breastfeeding journey, just make sure that you have your milk supply well established first before you jump on taking oral spironolactone. So that's it for treating hair loss, but I want to offer you additional tips that should not be overlooked if you're trying to maximize hair growth. Number 1, make sure to continue your prenatal vitamin. And if you're not on a prenatal vitamin, make sure you're on a multivitamin or at least supplement for iron and vitamin D. When it comes to hair loss and hair thinning, low levels of iron, zinc, and vitamin D can certainly be contributing factors. And if they're low, even if they're not the true culprit, you're gonna have a hard time growing hair to the maximum potential. How do you know if you're low? Well, a lot of women tend to be low postpartum because of the bleeding, but best to see a provider to have them checked. It's a blood test. Number 2 is to check in with your scalp. How's your scalp doing? We focus so much on the process of growing hair, but we often neglect the most important environment where hair grows out of, and that is your scalp. Even if you know that you're losing hair because it's that postpartum period, but your scalp health is not optimized, you're going to have a hard time growing hair. I personally have struggled the most with dandruff this time around postpartum. I don't know, probably it's the hormones with having a boy. I had a girl last time. I certainly did not go through this. Or maybe it's just the changes of season with the winter being here. But I have struggled so much with dandruff this postpartum period. You know, I used to be a twice a week hair washer, and that included me like working out on a regular basis. This time around, postpartum, I'm just a couch potato sitting on my bum every day, and I literally had to wash my hair every other day, if not daily, because it got super greasy, itchy, and flaky. So when your scalp is itchy and flaky, that is your scalp telling you I need to be taken care of. And the best thing to do to treat dandruff is to use an anti-dandruff shampoo. In fact, when it comes to treating hair loss as a dermatologist, I will often prescribe anti-dandruff shampoos as a part of the hair loss treatment regimen, because we know that dandruff and sebum are pro-inflammatory. And when your scalp is in an inflammatory state, it's not optimized condition for hair growth. And an anti-dandruff shampoo can work really well, especially when you combine it with other topical treatments, for example, topical minoxidil in growing hair. Formulations I like, ketoconazole is a great one that's very effective that I often will prescribe. There's Nizoral over the counter, but I personally find those to be a little too drying for my color treated hair, which with all the processing is more on that dry and brittle end. So I've been using more gentle formulations that contain zinc, parathione, and salicylic acid. So the two that I've been alternating every time I wash my hair is the one from Neutrogena, their new scalp therapy anti-dandruff line that contains salicylic acid of various concentrations that helps to remove flakes and excessive sebum. Another one that I also like is from First Day Beauty. I've talked about this before, their anti-dandruff shampoo that contains 1% zinc parathione. The reasons why I like these two shampoos a little bit better for my hair is, again, these are safer to use in color treated hair and they're less dry, especially now that I'm finding myself having to wash my hair a little more frequently. The other thing is, don't neglect your hair. A lot of times when it comes to hair thinning, it's not just the hair loss, but the breakage that also contributes to the overall low density, especially if you're someone who does a lot of coloring, heat styling, or chemical processing. Consider taking a break or using a deep conditioning treatment at least once or twice a week. The deep conditioning mask I've been loving lately is from Virtue, and it's their Restorative Hydrating Treatment Mask. This contains brown algae, plant extracts, as well as oil derived from an African tree. And I personally love this because it's very thick and conditioning and nourishing on my dry ends. It really makes my hair feel instantly soft and conditioned and manageable. Two, I love that you can get a deep conditioning done in 2 to 3 minutes. A lot of the deep conditioning treatments are 5 to 10 minutes, and these days with a newborn, time is of the essence, and I feel like taking a shower sometimes is a luxury. So any treatment that allows me to do in a short amount of time that can get the job done is a bonus for me. So this is one I have been using about once a week and really been enjoying it. Another treatment that I've been using and really enjoying the past month is a leave-in treatment, and it's from Living Proof, their Triple Bond Complex. This is essentially a leave-in treatment / leave-in conditioner. I like this because, number one, when I put it on after I shower, it instantly makes my hair more manageable, softer, and conditioned. But two, this contains their bond repair patent pending technology that's actually heat activated. So what it does is it helps to repair the damage, helps to protect hair from heat damage, but it takes it to the next level where that repair system is actually even better once you activate it with heat. So if you're someone who likes to do a nice blowout once or twice a week, you certainly can consider adding this in before you blow dry your hair. So not only are you getting a nice hairstyle afterwards, you're protecting your hair and treating your hair while you're doing so. One last thing I just want to mention is that hair loss can be quite complex, and often it's not caused by one thing alone. So if you're an individual who continues to experience hair loss many months after pregnancy, and or you're not having the response that you hope to have with the treatments I mentioned earlier, please check in with your provider, with your dermatologist, to have a proper evaluation and the treatments that you need to allow you to maximize hair growth. That's it for today's video. I hope you guys enjoyed it. Comment below and let me know if you have experienced postpartum hair thinning and what you have done to help you recover. If you like this video, please give it a thumbs up and subscribe to my channel, and I'll talk to you guys next time. Bye.